Joining me now to help make sense of all of it is Dr. Suzette Oyeku, Chief of Academic General Pediatrics at the Children's Hospital at Montefiore. So, Dr. Oyeku, you specialize in both healthcare and health equity. And we know from plenty of reporting that low-income women, families, and children are the ones that are being hardest hit by this formula shortage. How are you advising your patients to get through these next few weeks when we just don't have access to the formula that's needed?
Thank you so much for having me. How we've been advising our families, I think it's in multiple ways, is one, just having a conversation about their child-specific nutritional needs. So depending if a child has allergies, if they have a digestive problem, a genetic problem, or metabolic problem, then we'll discuss if they're able to switch between brands. We also have opportunities to talk to other vendors to see if we're able to get the family the formula that they may need. We also discuss in terms of the introduction of complementary foods, particularly if there's a child 4 to 6 months of age, they may be able, depending on their developmental milestones, they may be able to introduce complementary foods. But the first starts with the conversation about the child's specific nutritional needs and then how we're best able to meet that and support the family.
Doctor, it's really important that we deal with the fact that there's a lot of misinformation floating around online, people going and being Dr. Google, right? From substitution suggestions to do-it-yourself recipes for formula at home. What are some of the things that people should absolutely not do whatsoever?
Thank you so much for asking that question. One of the things that we encourage people not to do is not to dilute their formula. So you should not add water to stretch your supply. Unfortunately, we've already heard reports, and we've also seen it in our own practices, that we've also seen individuals add water, and then that leads to dehydration. It can lead to electrolyte abnormalities, and it also can put children at risk for seizures. So one, do not dilute the formula. The other is not to make homemade formula. So there are many recipes that are circulating online from the 1940s that use evaporated milk and Karo syrup. We know from studies that that formula, infants that were fed that formula in the 1940s, 1950s, actually had low iron, had low levels of thiamine and other essential nutrients. And we know that those children and also were at risk for anemia. So that is why we've recommended that infants typically get fed iron fortified formula or express breast milk or breast milk directly. There are some kids, unfortunately, due to allergies or other medical conditions, that they're not able to either breastfeed or use for iron fortified formula. And in those cases, that's where we have these specialized formulas, that this is one of the issues that we're seeing right now, is those kids are having a difficult time to be able to access those specialized formulas. So one, don't dilute the formula. Two is not to make your own homemade formula.
I want to play quickly a piece of sound for you and get your reaction to it on the other side. Let's listen.
Okay.
Moms and dads all over the country, some of them are traveling hours every single day looking for baby formulas. This is a crisis that should never be happening, and this is completely, squarely on the shoulders of the Biden administration and the Democrats that are controlling our government.
President Biden and the FDA must do more. This is a matter of life or death.
Maybe that's where this shortage is coming from, or it could be the pallets that are being sent to the southern border for all the illegal aliens breaking our laws to come into our country.
Putting aside the absurdity of those statements, Doctor, I do want to ask you for your opinion. What are you making of politicians using this moment for political gamesmanship when American babies are quite literally starving?
I think for us as pediatricians, really we want politicians and other key policymakers to use their power and all their levers to actually be able to put formula on shelves. No family should be in a position where they have to question whether or not they're going to be able to feed their child. And that's, I think, where we have opportunity. So where can policymakers focus their efforts? One, I think, is being able to provide resources to the FDA to be able to continue to ensure that our baby supply, our baby's formula supply is safe. The other is being able to provide support for those that are being covered by WIC. WIC actually covers about half of the population that uses baby formula. So we need to ensure that those children have access and that their waivers that are available are used across the nation so that people can be able to use their WIC benefits to get the formula that their children need. The other is being able to make donor milk accessible. So right now, donor milk is prohibitive in terms of cost and supply. And we need to be able to leverage insurance companies to be able to make this a covered benefit for families, particularly those families that have preemie babies. The other is that we have a lot of older children who have medical complexity and who need specialized formula and specialized food. Those specialized formulas and food need to be able to be covered by insurance companies. And for no family should have to choose between how they're going to decide to feed their child. So those are opportunities for policymakers to actually use their positions to be able to ensure that every child is able to get the nutrition that they need to foster their overall growth and development.